is addressing the maternal adaptation during pregnancy. And during pregnancy, the pregnant mother will undergo significant both anatomical and physiological changes. And all those changes are done in order to nurture and accommodate the developing of the fetus and also to prepare the mother for the labor. These changes start um, quite immediately after the conception and will affect ultimately every organ and system in the body. The psychological changes also will occur as the woman prepares to become a mother. And in chapter 6, I will associate it with chapter 16 that addresses the nutrition. Um, we will explore the signs of pregnancy, all the physiological and psychological changes that will be associated with pregnancy, as well as the changing in terms of nutritional requirements for the pregnant woman. Those are the objectives for the current presentation. Please take a moment and look over them. So a woman will look for confirmation of pregnancy, whether she's trying to get pregnant or even if she just thinks that she might be pregnant. And the healthcare provider will use a combination of signs to diagnose pregnancy. When we are looking into those signs, we have what is called signs that are considered presumptive. We have others that are called probable, and we have those that are positive. Now, we will look in each of those categories. And if we look at the signs that are categorized as presumptive, um, those are considered subjective. And usually, they are signs or symptoms a woman may experience and report them to the healthcare provider. Each of these signs, taken, taken alone, um, can have other causes than just pregnancy. The same is true for the probable signs. The only signs that are objective will be your positive signs. And those are the elements that the examiner, the provider, are able to confirm, and they are the only signs that are 100% diagnostic for the pregnancy. So when we are looking at the presumptive signs, presumptive in English means a speculation or something that is not confirmed. You just presume that it happens or it exists. So these are signs of pregnancy that the woman may experience and make her suspicious that a pregnancy may happen. Therefore, these signs are based on her report and they are subjective. They are not definite in that they indicate the baby is growing in the uterus, because other condition may be characterized with just the same signs. And probably the most common one that you will find that has all those presumptive signs will be the PMS, the premenstrual syndrome disorder. However, the woman can presume she may be pregnant, and the presumptive signs will include, and actually you can use the acronym PRESUME, Presume, P, period absent or amenorrhea, R, really tired or fatigue, E, enlarged breast, S, sore breast, U, increased urination, urination increased, and M, movement of the fetus in the uterus. And yes, of course, at the beginning of the pregnancy, if you um, um, hear about a woman that thinks that she feels movement of the fetus, um, that may be called quickening, but quickening cannot be felt until week 16 um, for the multi-pari um, women, those that have more than one pregnancy, and not before week 20 for those that are the first-time moms. And E in presume will stand for emesis and nausea. Now, if you look into this, you see that tender breasts can be caused by any kind of hormonal changes. Amenorrhea or missed period can be caused by any other hormonal imbalances, including emotional stress or illness, and in some patients that are professional athletes, by continuous physical effort and intense physical effort. And frequent urination can be a result of a UTI or nervousness. Now we are going to look into the probable signs of pregnancy. So probable means likely, probably, or very likely. So this pregnancy signs um, that both the doctors or the nurses may observe and document. However, they are not signs that will give you 100% confirmation a baby is growing in the uterus. That's why they are not the most objective elements that you can have to confirm a pregnancy. And again, you can use the uh, probable acronym, Probable, and we're gonna take them one by one. Probable, the P, the first P, um, is not the first P, is the only P. I'm sorry for that. Probable P is for positive pregnancy test. So um, we do have household type of pregnancy tests that can be performed, and they have a high percentage of accuracy. However, a lot of them may be false positive. So the pregnancy test is measuring the presence of a hormone in urine, or can be done in blood. Those that are used for home use are testing the human chorionic gonadotropin, or HCG, in urine. There are some other conditions that may have increased level of HCG in urine, and those are cancerous types of conditions, as the hydatidform mole and choriocarcinoma. R, improbable, is returning of the fetus or bouncing back of the fetus against the fingers whenever the uterus is pushed during palpation. This is also called external ballottement. It's also can be elicited by a tumor that develops inside the uterus, so it's not a perfectly positive sign. O stands for outline of fetus that can be palpated in those more advanced um, pregnancies. B stands for the Braxton Hicks contractions. Those are what is called a false labor contraction. They are not regular, will not result in a cervical dilation, and they are not painful. A stands for a softening of the cervix, or the Goodell sign. That's a sign that can be observed around weeks 6-8 of gestation, and can be felt by the provider while performing the bimanual examination. B, the first one, um, again, I'm confusing you. It's not the first one, it's the second one. Uh, the second B stands for bluish color to the vulva, cervix, and vagina due to an increased blood flow, and it's called the Chadwick sign. And that can be observed by the provider when he's doing the examination of the patient, starts around week 4. L is the lower uterine segment softening, or the Hagar sign. Happens around 6 to 12 weeks as gestations, and E stands for an enlarged uterus. Now, the positive signs of pregnancy, positive means conclusive or definite or absolute, and those signs are present because they can only be attributed to the fetus. There is no other cause that can produce them. And obviously, as a result of that, we say that the woman is pregnant. Again, you can go by the acronym fetus, and F stands for fetal movement felt by doctor or nurse. You will feel by just placing your hand on the patient's abdomen the fetal movements. E is electronic device that detects the fetal heart sound, or the Doppler. Once placed on the abdominal wall of the patient, will measure the heartbeats. T is the delivery of the baby. Uh, Obviously, when a baby is delivered, that was a pregnancy. U is the ultrasound that is able to show the fetus, and even measure it, and observe and measure the heart rate. And S is the visible movements of the fetals the fetus by the doctor or the nurse, and you you know that sometimes you can even see the movement of the baby while the abdominal wall of the mother is shifting side to side under the baby's movements. Question one. Um, Starting somewhere around the 6th week of pregnancy, HCG becomes to be found in the urine. However, HCG in urine is not a positive sign of pregnancy. What could its appearance in the urine be due to? And you can select more than one. The correct answers are A and B. Choriocarcinoma, it's a malignant cancer, usually of the placenta, and it's characterized by early spread to the lungs. It is very aggressive type of cancer. It is also classified as a germ-cell tumor and may arise in the testis sometimes or in the ovary. And hydatiform mole is a type of tumor that consists of many cysts or sacs of fluid. It looks a like grapes, and it's usually benign. However, can spread to nearby tissues if it's the form of invasive mole and may become malignant and become a choriocarcinoma. Those two pathologies are pathologies of the pregnancy. In those pathologies, there is no fetus associated with that pregnancy, and they are considered malignant conditions and are associated with high and sometimes very high levels of HCG. Question number 2. The client states she is 2 weeks late for her menstrual period. She has been feeling tired and has had bouts of nausea in the evening. What is the classification of the pregnancy symptoms Amanda is experiencing? And the options are positive, presumptive, probable, or no classification for those symptoms. The answer is B, presumptive. They are those signs that are found in the presume acronym. Period absent, P, R, really tired, E, enlarged breast, S, sore breast, U, urination increased, M, movement of fetus, or E, emesis and nausea. So those are presumptive. This acronym presume is very easy to remember. The woman's body will go through tremendous changes throughout the pregnancy to accommodate the pregnancy and to prepare her for the physiological act of birth. While she's pregnant, the body needs to still maintain all the vital functions while still caring and being able to allow the development of the growing fetus. Some changes are structural and occur because of the pressure exerted by the growing fetus and expanding uterus. However, other changes are purely hormone related, and those changes sometimes can be extremely uncomfortable. They are, however, normal, and they are in place to allow the female body to nourish and protect the fetus, prepare the body for labor and delivery, and later for that, for the postpartum period, to develop the breasts and allow them to start the production of milk. And we'll look at the beginning to the reproductive changes. So the female reproductive hormones, estrogen and progesterone, are those chief hormones that are that will be found throughout the whole pregnancy. The woman will produce a little bit more estrogen during one pregnancy than throughout her entire non-pregnant life. And the estrogen will increase and promote maternal blood flow within the uterus and the placenta, making sure that the fetus is supplied with nutrients and oxygen at all given moment while the waste products will be removed. If you want to look into that, you will find out that the fetus is the perfect parasite, will completely may deplete the woman from all the resources while continuously growing and developing. On the other hand, the progesterones levels can reach very high levels also. Among other effects of progesterones, um, it may cause some internal structures as uterus to increase inside, and this is in place to allow um, the baby to accommodate up to a full-term baby. After conception, the uterus um, will provide the nutrition and the protective environment for the fetus to grow and develop. The tissues from which the uterus is made will continue to grow during the first 20 weeks, and the uterus um, weight itself will increase from 50 grams to up to 1,000 grams. So from a structure that was only 50 grams ends up to be a structure of 1 kilo, which is a little bit over 2 pounds. And that's just the weight of the uterus itself of the organ. After this time, that does not get any heavier, but it stretches to accommodate the growing baby, the placenta, the amniotic fluid. By the end of the pregnancy, the uterus will have increased to about 5 times its normal size. Um, if we need to give some numbers, in height will increase from 7.5 centimeters to 30 centimeters, in width from 5 to 23 centimeters, in depth from 2.5 to 20 centimeters. And responsible for that is mainly the progesterone. Um, in terms of sizes, that if we look into that, by week 12 of gestation, the fundus will be palpated through the abdomen above the pubic bone. So the cut line when the uterus will start showing up from the pelvis out in the abdominal cavity will be week 12, or so called the end of the first trimester. At about 20 weeks, the fundus of the uterus will be found at the level of the umbilicus. And the peak is about week 36, that the uterus will be found pretty much at the xiphoid level. Beginning in the first trimesters, there will be some periodic and sporadical contractions of the uterus. Those contractions need to be painless and will not cause any kind of cervical changes. Somewhere by second trimester, those contractions become palpable, and the woman is more and more aware of them. They are called Braxton Hicks contractions. They are again painless, intermittent, and they are training contractions or practice contractions of the pregnancy. And they were named after the physician who wrote about them for the first time, and his name was Braxton Hicks. During the third trimester, as the pregnancy approaches the term, the Braxton Hicks contractions become more frequent and sometimes may start causing discomfort. That is the moment when the labor, it's the sign that the labor is very close. Those contractions will become more regular, that before they were like sporadic, and sometimes may confuse the patient, that may think that she's in labor. The blood supply to the uterus is increasing dramatically throughout the pregnancy based on the needs of the fetus. And under the influence of the estrogen, new blood vessels will develop inside the placenta and the uterine walls to maintain this increased need for oxygen and nutrients. Another element will be the vasodilation that occurs in the maternal blood vessels to allow for an increased blood flow both to the uterus and the placenta. The diameter of the uterine artery will increase during pregnancy. And just to give you an idea, by 20 weeks, it doubles in diameter from the non-pregnant state. When we are continue looking at the reproductive changes, the cervix will also undergo some characteristic changes under the influence of estrogen and progesterone. The vascular supply increases to the whole uterus, and the cervix is part of the uterus. So the vascular supply will increase to the cervix also. And the glandular tissue at the level of the cervix multiplies during pregnancy. As a result of vascular congestion and increase in the glandular tissue, we observe what is called the signs. There are three signs: Goodell, Hagar, and Chadwick. So shortly after conception, at the level of the cervix, a thick mucus plug will develop that will protect the uterine cavity from infection, will kind of seal out the opening of the uterus toward the outside environment. The mucus plug is expelled shortly before or at the beginning of the labor. Um, and usually small capillaries break when the plug is expelled, causing a bloody show. No other follicles in the ovaries will mature during pregnancy, so the ovulation completely stops. The corpus luteum that continues to function and produce progesterone for the beginning of the 6 to 7 weeks, while the corpus luteum will stop functioning um, anytime before these 6 to 7 weeks. A spontaneous abortion or a miscarriage will occur because the support, the hormonal support that is essential in the development of the pregnancy, will stop. So, in other words, corpus luteum is protecting the pregnancy and maintaining the pregnancy during the 6 to 7 weeks before placenta is able to take its place and produce enough progesterone to maintain the pregnancy. The cervix usually will remain 2.5 centimeters long throughout the pregnancy. Somewhere in late pregnancy, there will be a softening of the cervix um, that occurs in response to an increasing painless contractions of the muscular wall. And that's how we um, um, are able to examine the patients and to let them know that they are getting close to delivery. In the Goodell sign is a significant softening of the vaginal portion of the cervix from increased vascular supply. And again, the increased vascular supply is the result of two elements, the hypertrophy and engorgement of the vessels below the growing uterus. So this sign, Goodell sign, is evident somewhere along week 4 of gestation. The vagina will also become more elastic, especially towards the end of the pregnancy. And all those changes will enable it to dilate during the second stage of labor as the baby passes down the birth canal. So the vagina and the perineum are affected by hormonal changes and by the increased blood supply to the whole area. And as a result of that, the vagina will take a bluish purplish hue that is called a Chadwick sign um, due to the same increased vascular congestion. In addition to that, both vagina and the cervix will produce an increased secretion as a result of the increased blood flow to the mucus glands in those two structures. Now, let's look at the breasts a little bit. In the first few weeks of the pregnancy, the breasts become tender and the woman may feel a tingling sensation. While the pregnancy progresses, the breast increases in size under the influence of the estrogen. In addition to that, the prolactin, which is an anterior pituitary hormone, if you remember that, stimulates the glandular production and are causing the breast tissue to feel more nodular. And that those parts of the breast that were fat before will become more and more breast tissue and glandular tissue. The areolas will darken. The Montgomery tubercles that are sebaceous glands on the areolas will start producing a secretion that lubricate the nipple. In addition, Montgomery tubercle will become more prominent during pregnancy. There will be an increased web of tiny veins that become visible on the surface of the breast. At this stage, strias, that they are more commonly known as stretch marks, may appear in some of the patients. All those strias usually will be reddish at first and will gradually fade to a light silvery color after childbirth, and sometimes may take up to a year and even more than that for them um, uh, to go through the healing process, maturation process. As the mammary glands develop, the breast began to produce and secrete what is called colostrum, which is a thick yellow fluid that is a precedent to the actual milk production. During the first 3 days of breastfeeding, colostrum it's very high in nutrients, and that's what nourishes the baby. It's very rich in antibodies, calories, and protein. So it gets replaced by milk later that has a high fat component. However, the colostrum in the first 3 days, even in very small amounts, is able to feed the baby. The endocrine changes. So you've seen that when we are talking about physiologic adaptation, I'm going back to hormonal influence of hormones. So hormonal changes are tremendous. Um, and the changes in the endocrine system itself happen during the pregnancy. Pituitary gland will enlarge by, sit down for that, 135% compared to its non-pregnant size. So the whole pituitary gland increases in size. In fact, pregnancy could not occur without the interaction of the pituitary hormones, and especially the follicle stimulating hormone and the luteinizing hormones, those hormones that are acting at the level of ovaries, and they are promoting and maintaining the secretion of estrogen and progesterone. In addition to that, prolactin levels will increase progressively during pregnancy to maintain the production of breast milk. So, although this hormone is not necessary for the successful completion of pregnancy, it is crucial for initiation of lactation. In addition to those three hormones, there is a fourth hormone at the level of the pituitary gland that comes from the posterior pituitary gland that is called oxytocin and is responsible for the rhythmic uterine contractions during labor. Oxytocin also stimulates the let-down reflex during breastfeeding, and stimulates the uterus to continue contracting after delivery, and by doing that is controlling maternal bleeding. Hyperplasia of the glandular tissue and an increased vascular supply cause also the thyroid gland to increase in size. In the rest of the body, the need for insulin is increased, and some women have borderline pancreatic activity when they are not pregnant. During pregnancy, those women may develop gestational diabetes because of their borderline pancreas that was in normal situation was kind of barely able to control the glucose levels. However, now with an increased demand for glucose, the pancreas in those borderline type of cases will not going to be able to handle the situation. If we are looking to the hematologic system now, plasma volume will increase progressively throughout the entire pregnancy, and that's normal. Um, Most of this, about 50% increase, occurs by week 34 of gestation and is totally proportional to the birth weight of the baby. Because of the expansion in plasma volume and because this is greater than the increase in red blood cell mass, there may be a fall in hemoglobin concentration, decrease in the hematocrit and in the red blood cell count, because that's a ratio, that's a report, and because plasma is increasing more than the red blood cell mass, those um, um, measurements may seem lower. The platelet count tends to fall progressively during normal pregnancy. However, it is supposed to stay within normal limits, and we want to see that in normal limits to prevent any type of bleeding during vaginal deliveries. Any changes in the coagulation system during pregnancy may produce a physiological hypercoagulability state. And that's kind of a preparation of the female body to delivery and prevent an eventual bleeding complication. Thus, pregnancy will alter the balance within the coagulation system in the favor of clotting. There is a predisposition for pregnant and even postpartum women to venous thrombosis. And this will increase the risk, especially in the first trimester, and at least for about 3 months after delivery. Venous stasis in the lower limbs will be associated with a vasodilation and a decreased flow, which can be more marked on the left because the way that our um, cardiovascular system is structured. Now let's look into the cardiovascular changes. And those are also profound and began very early in the pregnancy, such that by week 8 of gestation, the cardiac output of the mother is already increased by 20%, by a fifth. The primary event is related to peripheral vasodilation, and that leads to a 25, between 25 and 30% decrease in systemic vascular resistance. Because the blood vessels are dilated, um, we have a reduction. The blood pressure will be lower, and that's one of the elements that will predispose the women during the first trimester to fainting very easily. Now, the cardiac output needs to increase to compensate for this vasodilation and for the drop in the blood pressure as a result of vasodilation. And the cardiac output will increase up to 40% during pregnancy. And this increase is achieved predominantly as an increase in stroke volume, but also as a result in an increase in the heart rate. Lower blood pressure, that can be a result also of vasodilation. Again, it's very common in early pregnancy, and that's how many of your patients may report feeling dizzy in the first trimester, because um, blood less blood will get to the brain as a result of um, a decrease in the blood pressure. A little bit later, when the woman lies flat on her back in the later half of the pregnancy, uterus is very heavy by now. It's carrying the fetus and the amniotic fluid, and its content may compress the aorta and the cava against the spine. And by this compression, there is a decreased amount of blood returning to the heart. Therefore, the cardiac output and the blood pressure may fall, leading to what is called the supine hypotensive syndrome. And while laying flat, the patient may feel lightheaded and dizzy with all the signs of fainting, pallor of the skin, clamminess. The cure is, and even the prevention, is extremely easy. Is just to rest on her side. The traditional position for a pregnant woman at rest is left side lying. By doing that, the position of the uterus is released from putting pressure on the major abdominal blood vessels, is displaced and is releasing the flow. Respiratory changes. And you can see that we are going system by system. During pregnancy, the amount of air moved in and out the lungs will also increase, and it will increase by nearly 50% and through two different mechanisms. Each breath contains a larger volume of air, and the rate of breathing is increasing slightly. So the respiratory system must accommodate to changing needs and the demands of the pregnancy, because now we are supplementing air and nutrients, oxygen and nutrients to another human being. And vasocongestion of the upper respiratory tract lining may cause symptoms that may seem similar to those of the common cold. There will be a nasal congestion and a voice change that sometimes may persist throughout the whole pregnancy. The nasal lining is more fragile as a result of this congestion and may have an increased risk for or likelihood for nosebleeds. It is thought that estrogen influences these characteristic changes, and during pregnancy, a lot of the women may find themselves short of breath, or they cannot breathe as deeply as they did usually. And this is mainly because the growing baby will crowd the mother lungs, and she has less volume to breathe into. There is also a significant increase in oxygen demand during normal pregnancy, and that's because there is an increase in the metabolic rate between 50 and 20% and an increased consumption of oxygen. One adaptation to this function is the fact that women are a thoracic type of breather, as opposed to a male that they are using their abdominal muscles for breathing. Women are using mainly their thoracic cavity muscles and not that much the diaphragm. Now let's look into the musculoskeletal changes. The lordosis is that curvature of the spine in the lower back, in the lumbar area of the spine. And lordosis will become more and more pronounced in the later weeks of the pregnancy. As you can see in this picture, is the expanding uterus will change the center of gravity, and the lordosis will counterbalance the effect of the protruding abdomen and keeps the center of balance over the lower extremity. Otherwise, the woman will fall face first. The increased curvature may result in low backache, obviously, because there is a change in the connection between all those vertebrae. Hormonal changes will influence also the pelvic joints, and they will increase the mobility at the level of the pelvic joints. That will contribute to the lower back discomfort and may cause something that is a very characteristic waddling gait of the pregnancy. Now, the enlarging uterus puts pressure on the broad and round ligaments that will support it. And this prolonged pressure can lead to round pain ligament enstretchment. And usually this pain was described as either sharp stabbing or as a dull ache or as a burning sensation. And that burning sensation is felt internally and follows a path of high bikini cut outline. Um, a woman who has been pregnant several times or those that are carrying twins are more likely to experience what is called the diastasis recti abdominis, which is a separation of the rectus abdominis muscle that support the anterior part and the central part of the abdomen. And now let's look a little bit into the gastrointestinal changes. Uh, Nausea and vomiting are very common in the first trimester, and mainly they are the result of an increased HCG levels. Again, we are going back to the hormones. Occasionally, a large increase in saliva production may happen, and this has a term in a medical term is called ptyalism. The gums may become tender and may bleed easily, just like the same type of increased vascular supply, like we have the nasal congestion at the level of the face. The gums will be are going through the same type of changes. As the uterus expands upward into the abdominal cavity, you can imagine that all the organs inside will be displaced and they will change their position. They will either move sides or upward, depending where they are positioned in their original placement. So if we are looking at the stomach, which is in the epigastric area, it will be pushed upward and will be compressed. The lower esophageal sphincter, as a result of that, will become relaxed and also will open the angle under the influence of the hormones. The pressure in the esophagus are lower than in the normal pregnant state, and as a result of increased pressure in the stomach, you will have an increased incidence of heartburn or pyrosis, and this is the result of acid reflux through the relaxed lower esophageal sphincter. Displacement of the intestines and possible slow motility under the influence of progesterone may lead to delayed gastric emptying and decreased peristalsis. And as a result of those changes, most women will suffer of constipation. Now, because they may suffer of constipation and they may have elevated pressure in the veins below the uterus, those two elements will contribute to development of hemorrhoids. And hemorrhoids are varicose veins that develop at the level of the anal canal. This slowed motility might also be beneficial to maximize absorption of nutrients from the diet. And progesterone will interfere, in addition to other organs, to the normal gallbladder contraction, leading to bile stasis. Bile stasis is called cholestasis, and associated with an increased cholesterol level may increase the risk for gallstone formation. And that's very typical for a lot of pregnant women to suffer of gallstones immediately after um, giving birth. Cholestasis may occur also inside the liver, and as a result of that, there is a certain level of jaundice, and while jaundice develops in the tissues, that can lead to pruritus or itching. Urinary changes. So renal and urethral dilations occur as a result, again, of hormonal changes, especially progesterone, and due to mechanical pressure of the growing uterus on the ureters. The dilation will cause an increase in kidney size, particularly on the right side, and peristaltis at the level of the ureters will be decreased, just like in the gastrointestinal system, leading to urinary stasis, and as a result of that, an increased risk for pyelonephritis, which will be infections. The glomerular filtration rate will increase by 50%, and that's mainly due to an increased cardiac output and a decreased renal vascular resistance. This increase in the glomerular filtration rate usually is evident by week 10, and will be responsible, as a result of that, you will see an increased frequency noted in the first trimester. So urinary frequency is not a common complaint in the second trimester. However, it returns in the third trimester because of the pressure of the expanding uterus on the urinary bladder. There is one thing that we need to discuss here, and that's glycosuria, or glucose, presence of glucose in the urine. And that may occur as a normal thing because of the kidney tubules are not able to reabsorb as much glucose as they were before pregnancy. However, if the woman is eliminating glucose in her urine, and we find that during our urine testing, that will trigger additional testing in order to rule out gestational diabetes. There is not normal to find proteins in the urine of a pregnant woman, no matter at what stage of pregnancy. Presence of protein in the urine will trigger more testing to rule out pathology of the kidneys. So in this slide, you have a reviewing table of all the physiological adaptation that we discussed in the previous slides. You may want to stop here the presentation and review them a little bit. Question number 3. Identify whether the following statement is true or false. During pregnancy, the pituitary gland increases in size by about 135%. The statement is true. The pituitary gland enlarges to 135% compared to its non-pregnant size due to the increased production of FSH, LH, oxytocin, and prolactin. Now, this is a little pregnancy humor, and we are now going to move on to nutritional requirements of pregnancy. It is essential to discuss about the nutritional requirements during pregnancy, and that's because they change as opposed to the situation of a non-pregnant state. Due to the pregnancy and the needs of the fetus, the nutritional requirements will increase. The fetus needs energy and nutrients in order to build and develop and mature new tissue. while on the other hand, there are those changes at the level of the woman's body that will require also nutrients to build the additional blood volume and in order to not deplete maternal storage. There is an increased demand for energy, and that is observed at the level of almost every type of nutrient. Most nutrient requirements during pregnancy can be met easily through if we pay careful attention to the diet and not by making critical changes. There are several nutrients that will require supplementation during pregnancy, and we'll discuss all of those a little bit during this presentation. So many women will maybe falsely assume that eating for two requires a significant increase in the caloric intake. In fact, the required caloric increase during the first trimester is negligible. It's nothing. During the second and third trimester, there is an approximately 300 kilocalories per day required over the pre-pregnancy needs. It is, however, important that the diet supply enough calories to meet the energy needs. Otherwise, the protein will be broken down to supply energy rather than build fetal and maternal tissues. And the part that will suffer from that will be mainly the mother. There is a weight gain recommendation, and the total weight gain recommendation may vary depending on the woman's pre-pregnancy BMI, body mass index. A woman who is underweight when she enters pregnancy with a low BMI should gain between 28 to 40 pounds, while a woman who has a high BMI is considered overweight is recommended to gain not more than 25 pounds during the pregnancy, ideally 15. The failure to gain enough weight, and in particular gaining less than 16 pounds during pregnancy, has been associated with an increased risk of delivering a low birth weight baby. That is defined as a baby that weighs at birth less than 5.5 pounds or 2,500 grams, 2.5 kilos. Low birth weight has consistently been associated with poor neonatal outcomes. Conversely, a woman who gains too much weight is at an increased risk for delivering what is called a macrosomic baby, or a baby that weighs 8.5 pounds or more, over 4,000 grams. High birth weight babies will experience also complications and poor outcomes more frequently than those babies that have a normal birth weight. A woman who gains too much weight is also a greater risk for requiring a cesarean section because of the disproportion between the size of the baby and her pelvis. During the average pregnancy, approximately 1,000 grams of additional protein above the woman's basal needs is used. And 1,000 grams is a kilo. It's a little bit over 2 pounds. The fetus and placenta account for 500 grams of the added protein needs. That's a little bit over a pound. The remaining proteins will be distributed among uterine muscle, mammary gland tissue, and maternal blood in the form of hemoglobin and plasma proteins. The woman will need to take in 5 to 6 grams of protein per day above her non-pregnant requirements in order to meet those additional demands. Pregnancy causes a 2 to 3-fold increase in the requirements for iron, not only for hemoglobin synthesis, but also for the fetus and the production of certain enzymes, both for the mother's body and the baby's body. There is a 10 to 20-fold increase in folate requirements and a 2-fold increase in the requirement for vitamin B12. It is almost impossible for the woman to receive an adequate amount of iron from her diet alone. Therefore, it is recommended that the pregnant woman take iron supplements as well as vitamin B supplements. Those are essential for the nervous system development of the baby. So, protein needs are increased during pregnancy because of growth and repair of fetal tissue, placenta, uterus, breast, maternal blood volume. So the source for those protein is recommended to be animal source, including milk and milk products. In addition to the proteins from those sources, calcium needs are not increased above the pre-pregnancy levels. They are about 1,000 milligrams per day, mainly because uh, the pregnancy state will enhance the calcium absorption. However, it is important for the pregnant woman to have those amounts of calcium available. Um, Calcium is needed for a variety of bodily processes, including, if you remember from anatomy, nerve cell transmission and muscle contraction and bone building and blood clotting. Um, we consider milk as an excellent source of calcium. Um, Make sure that your patients will drink milk. Yogurt and cheese will have lower um, um, levels of calcium, and the calcium from yogurt and cheese have a lower availability for absorption than the calcium that is present in milk. In terms of other minerals that the body requires, there is a need for phosphorus that is promoting a strong bone growth, zinc for fetal growth and maternal milk production, and iodine that will promote a normal development of the thyroid activity, and especially the thyroid in the baby will develop normally. Will also prevent some birth defects like hypothyroidism. As a result of hypothyroidism, if you remember from term 2, we see in those babies stunted growth and very low intellectual ability. There, it's called cretinism. Going back a little bit to discuss the folic acids. So the folic acid is a vitamin B, B9, and it prevents up to 70% of birth defects of the central nervous system, those that are called neural tube defects or spina bifida. Um, because formation of the nervous system occurs very, very early during the pregnancy, in the first few weeks of the pregnancy, when usually most of the women are not even aware that they are pregnant, all women at childbearing age, and especially those that are actively looking into becoming pregnant, they will need to take about 400 microcentigram supplements of folic acid in addition to have a nutritious diet. And we have enough studies that suggest that intake of adequate folic acid can prevent other birth defects as cleft lip or palate. Vitamin A is usually found, it's sufficient usually in our diets, especially for the women living in United States. A lot of the products are enriched into those, both folic acid and vitamin E. Um, One concern is when a pregnant woman consumes too much vitamin E. In very large amounts, with levels over 10,000 units, vitamin A can actually cause birth defects. For this reason, pregnant women are encouraged to get the majority of their vitamin A intake from what is called the beta-carotene, and that's the substance found in fruits and vegetables that are yellow, orange, or red colored, like carrots and sweet potatoes. Um, the body will convert the beta carotene to vitamin A that is less toxic than a preformed vitamin A that can be taken as a supplement. The key is the balanced intake of this nutrient. Too much can be toxic, however, too little may stunt the fetal growth and cause some impaired adaptation to darkness, because if you remember, the vitamin A is associated and influences our vision, and it may cause in some patients even a night blindness in the fetus. Vitamin C. Vitamin C is necessary also for normal fetal growth and bone formation. Again, if you remember from your anatomy class, vitamin C is essential for the normal collagen development. Also, the vitamin helps the body to absorb iron. Most of the women living in the United States um, do get the necessary amounts of vitamin C in their diets. We can find vitamin C in most fresh fruits and vegetables. Probably the best source of vitamin C will be the citrus fruits, papaya, strawberries, broccoli, tomatoes. Moving into vitamin B6 or pyridoxine, this is a vitamin that assists in the metabolism of macronutrients as protein and fats and carbohydrates and helps converting amino acids to proteins and to uh, use those proteins into forming, let's say, new red blood cells. This vitamin is necessary for the healthy development of the fetus nervous system, together with the folic acid. All the vitamin Bs are associated with a good function of the nervous system. Um, Although increased amounts of the vitamin are needed during pregnancy, a well-balanced diet will supply what is needed. Vitamin B12 or cobalamin is needed to, again, for the healthy of the nervous system and for the development of red blood cells. And it's involved in the development, formation, synthesis of new DNA. Vitamin B12 is only occurring naturally in animal sources, such as fish or milk, dairy products, eggs, meat. So can be found in fortified breakfast cereals. Most Americans will get sufficient amounts of vitamin B in their diets. However, we need to pay attention to vegans because those may need to get supplementary vitamin B12. Question 4 is asking which vitamin is most important for development of the central nervous system. And you have all the vitamin B here with the need for you to identify that it is essential for the central nervous system. Vitamin B12, B6, B9, or B1. The answer is vitamin B9 or folic acid, and this is the B vitamin that will prevent development of birth defects at the level of the neural tube. How do we look at dietary supplements? So a balanced diet is enough to provide the vitamins and the minerals necessary for a normal pregnancy. And there will be physicians that have, in general, will recommend to their pregnant patients prenatal vitamins. And those will have additional folic acids to prevent neural tube defects and iron supplements. Food safety during pregnancy is essential. And that because it will endanger not just the mother, but also the fetus. And consumption of unwashed fruits and vegetables, unpasteurized dairy products, raw eggs, or undercooked meats can be harmful to the developing fetus. So seafood now, if we are looking into that, has many nutritional benefits. However, sea fish and seafood can be contaminated, and most of them are contaminated with what is called methyl mercury, which is a heavy metal that can irreversibly harm the development of the fetal brain. Therefore, the FDA and the general recommendation is to do not serve to avoid seafood in pregnant women. Another type of recommendation will be to prevent for the pregnant women to avoid any type of deli meats because of listeria, and because listeria can affect and even cause can affect the fetus and cause miscarriages. A little bit of special nutritional consideration. Um, and we are looking mainly into different categories of vegetarians. The lacto-ovo vegetarian does not eat any flesh meat. They, however, do include in their diet milk, eggs, and dairy products. Um, the vegans are strict vegetarian and they do not eat milk, eggs, or any kind of dairy products. A special category of vegetarians is the fruitarian that only consume fruits and nuts. So a lacto-ovo vegetarian can easily get all the requirement nutrients for pregnancy by careful attention to a few basic principles. Protein has always been an area of concern for vegetarian diets, and fortunately, the lacto-ovo vegetarian can get sufficient proteins by drinking milk, um, by eating eggs and cheese and yogurts, and by combining those foods. Um, although vegetables and grains do not contain all the essential amino acids, there is a way to skillfully combine them, and all of the essential amino acids can be obtained. The general rule is to combine the grain and the legume. For instance, a corn tortilla, which is a grain, eaten with pinto beans, which is a legume, provides all the essential amino acids and qualifies as a complete protein. Other combination may be lentils and whole grain rice, peanut butter on whole wheat bread, and whole grain cereal with milk. Um, for the vegans, they will need to take extra care to get enough protein because vegans does not use milk or dairy products. So food combining, as discussed before, is an important nutritional strategy for the vegans. It can also help them um, if they can add fortified soy milk or rice milk to their diet. Larger amounts of nuts and seeds can help offset the protein requirements also. Um, in in pregnant vegans, it's essential to supplement vitamin B12 because if you remember, vitamin 12 comes from animal source only. Now, the last one is the fruitarian, and they will need intensive support in terms of diet, both from the healthcare provider and the dietitian. Um, Multivitamin supplements are necessary in this situation. Iron and zinc requirements have a high concern for this type of vegetarian, um, and they can be so they are the non-meat sources of iron are generally not absorbed as efficiently as the meat source. So the iron requirements for vegetarians are very higher. The same is true for the zinc absorption and requirements. Another thing that we need to discuss is the pica. And pica is the persistent ingestion of non-food substances such as clay or laundry starch or freezer frost or dirt, and is a result from a craving for these substances that some women may develop during pregnancy. So these cravings disappear when the woman is not longer pregnant. In some cases, pica may be accompanied and accentuated by iron deficiency anemia. Whenever you suspect or discover that a pregnant woman is practicing pica, you need to immediately alert your registered nurse or your practitioner because special counseling is indicated in this situation. So now that we are just at the end of this lecture, you can assess how well you have achieved the learning objective by answering these questions on your own. What causes back pain in pregnant women? What will happen to a pregnant woman if she is lying on her back? Describe the following signs and how it is classified: Goodell sign, Hagar sign, and Chadwick sign, and list psychological tasks of each trimester.